Hello everyone, thanks for joining us. This is Cindy Rogers from the Children's Safety Network at Education Development Center. Welcome to the first official day of summer and our webinar on drowning and drowning prevention among children. Before I introduce our two speakers, my colleague Rebecca Wilmer has a few technical announcements. Rebecca?
All right, thanks Cindy. So audio is currently being broadcast through your computer speakers, and the quality of the audio depends on the speed of your internet connection. So if the audio is choppy, please find a more stable internet connection or listen over the phone by dialing 866-835-7973. If you are listening over the phone, please mute your computer speakers to eliminate any echo. Phone lines will be muted during the presentation to eliminate background noise. Answers to frequently asked questions are in the webinar instructions pod. That's in the upper left-hand corner. And if you have questions or technical issues, you can type them into that Q&A box on the bottom left at any time. After the presentation, we will pause for the presenters to answer your questions. We also have a PDF of the slides available to download in the file pod that's right above the slide deck. So to download it, you can click on PDF of the slides, then select the Download Files button, and then it will save the document to your computer. You are currently muted, and the webinar will be recorded, and the archive will be sent out to all registrants within 2 weeks. All right, back to you, Cindy.
Thanks so much, Rebecca. So today we have two presenters who both have incredible experience in this topic, and I really appreciate both of them for accepting the challenge of sharing their expertise with us in such a limited time frame. Following both presentations, we will take your questions. And our first speaker is Adam Katchmarchi. Dr. Katchmarchi is an instructor and the aquatics director in the Department of Kinesiology, Health and Sports Sciences at Indiana University of Pennsylvania. He is currently the president of the National Drowning Prevention Alliance. His research interests focus on aquatic education and risk management, including lifeguard and swimming instructor professionalism and training, aquatic facility risk management, and evaluation of drowning prevention education programming. Dr. Katchmarchi's mission is to raise the bar for aquatic education and to conduct research that will further the field of drowning prevention and water safety to help save lives. Our second speaker is Alan Korn. Mr. Korn is the executive director of the Abby's Hope Charitable Foundation, where he assists the organization in its management, public policy, marketing, and public relations efforts. Before joining Abby's Hope, he was the executive director and the general counsel for Safe Kids USA, whose mission is to prevent accidental childhood injury. At Safe Kids, Mr. Korn also directed the public policy agenda at the federal level and guided the coalitions in their state advocacy efforts. Alan frequently presents on government's role in child injury prevention and liability issues associated with community-based safety programs. He has testified many times before Congress, federal agencies, and state legislatures on issues of injury prevention. Alan is an attorney and a member of the Missouri and District of Columbia Bar. And with that, we'll now get started with the webinar, and I'll pass the platform over to Adam Katchmarchi. Adam?
Thank you, Cindy. And thank you for all at home for joining us today, and thank you to the Children's Safety Network for hosting this webinar on such an important topic. My part of the presentation today is going to look at the problem of drowning in the United States and an overall scope of the problem, and talk a little bit on the prevention steps. One of the sources that I'll be citing the most today, along with the American Academy of Pediatrics, is the Centers for Disease Control and Prevention. They collect the majority of the data surrounding drowning in the United States, so I'll be citing them quite frequently during my presentation. The CDC does classify drowning as an unintentional injury-related death. Drowning is the leading cause of unintentional injury-related death for children ages 1 to 4, and I'll be coming back to that statistic at multiple times throughout my portion of the presentation. Before I take you through the scope of the problem, I think it's important to understand the overall drowning process. Our current definition of drowning comes from the World Congress on Drowning, which published their definition in 2002, which lists drowning as the process of experiencing respiratory impairment from submersion or immersion in liquid. Drowning victims can be seen across a full spectrum of different types of victims, ranging from the least severe to the worst case scenarios. The first edge of the spectrum, and I will note here that many different agencies will list the different types of drowning across the spectrum a little bit differently. I've chosen to list 4 today, the first one being an endangered drowning victim or an endangered swimmer. An endangered swimmer is someone who is not drowning just yet. They are able to make forward progress in the water. However, they have entered a situation in which if they don't exit it very quickly or intervention does not take place, it could become more serious very quickly. The next stage in the spectrum is often referred to as a distressed swimmer. The difference between an endangered swimmer and a distressed swimmer: a distressed swimmer is someone who can no longer make forward progress in the water. They are still able to keep themselves afloat, either by treading water or by floating on their back or front. However, they are experiencing something that is preventing them from reaching safety. An intervention does need to take place, either by a bystander who can reach or throw something out to the person, or by a lifeguard. A distressed swimmer, in many cases, will be able to yell out for help and alert someone that they do need assistance. The next stage in the spectrum is what we call an active drowning victim. Now, an active drowning victim is just what it sounds like. It is someone who is actively drowning. At this stage, the victim enters what's called the instinctive drowning response. This type of victim has entered a psychological response, and they will struggle at the surface for maybe between 20 to 60 seconds before they're submerged underwater. This type of victim, their main objective is to get air. They need air to survive. Their body features, they will likely be vertical in the water. They may resemble climbing a ladder with their arm motions pushing up and down, and legs providing a kick that also looks like they're climbing a ladder, but they are not able to make forward progress or keep their head above the water. This type of victim, like I said, their struggle will last for 20 to 60 seconds, and this victim is oftentimes not able to call out for help. As I stated before, this victim their main goal is to get air, so when their head reemerges from under the water, they inhale air. Now, I try this with my students at the university all the time when we discuss this topic, and since everyone's muted, you can try this at home. Try and scream for help while inhaling air. It doesn't work so well. So this is where drowning becomes a silent, very silent at this stage. So in the drowning community, we often are combating the term that we refer to as called a Hollywood drowning. You may see that on Baywatch, where a victim's out floating and they're screaming for help. That, in fact, is a distressed swimmer. They need help. They do need that intervention. But the difference with an active drowning victim, they are on a clock. They are going to be submerged under very quickly, and they need assistance. The last stage is a passive drowning victim. This victim may be at the surface of the water or submerged underwater. This victim is unconscious. Now, what's interesting to point out here is there is no set way that a victim is going to move through the spectrum of drowning. You may have a lapsed swimmer who becomes an endangered swimmer, moves to a distressed swimmer, to active, to passive. Or you may have a non-swimmer, a child with no swimming ability, who jumps in water that is too deep where they cannot touch the bottom, and they instantly begin the active drowning process. So this is a very fluid spectrum, and everyone or every victim may go through it at different speeds and at different rates. We have 2 outcomes when it comes to drowning. We have non-fatal victims and fatal victims. On this slide, I've used this chart in the past to depict the differences in drowning rates in 10-year increments. starting in 1981, going to 2011. And for this presentation, I've also added in the year 2015, which is the most recent year in which we have drowning data to look at. You can see it from a historical perspective. In 1981, we experienced 6,227 fatal drowning victims. That number dropped to 4,600 in 1991, down to 3,200 in 2001. Now, you'll see in 2011 and 2015, these numbers have gone up just slightly from 2001. But before we take away from this that we're experiencing a higher number of drownings in this country, I want to draw your attention over here to the numbers in parentheses. These numbers take into account population growth in the United States. So you can see in 1981, we expected to have 2.57 drowning victims per 100,000 individuals. 1991 down to 1.77, and in 2001, 1.19 victims. You can see in 2011, even though our crude number of drowning victims increased from 2001, our overall rate, when we take in population growth into account, this number has slightly decreased. So that's a good sign. When we talk about non-fatal drowning injuries, these numbers are estimations that the Centers for Disease Control and Prevention provide us. Non-fatal drowning injuries, these statistics are reported victims who went to an emergency department after experiencing submersion or immersion in water. In 2001, you can see about 5,600, 5,700, and these again are estimates. 2015, about 9,000. You'll see the letters CI and two numbers in brackets next to the CI. What this indicates is while the estimation is 9,000, our confidence interval, we're 95% sure the actual number falls between these two numbers. On this slide, this depicts drowning across the lifespan. I just pulled this week from the Centers for Disease Control and Prevention's database, and this is reflective of the 2015 data. This lists the top 10 causes of unintentional injury-related fatalities, and the highlighted numbers, as you can see, are unintentional drowning. For infants below 1 year of age, drowning is the number 3 cause of unintentional fatalities. For children 1 to 4, it's number 1. And for children 5 to 9, 10 to 14, it remains at the number 2 position. And it doesn't decrease back to the number 3 until the 15 to 24 and 25 to 34 age bracket. So as you can see, up to age 34 or 35, drowning is in the top 3 causes of unintentional injury-related fatalities. The next 2 slides give a visual depiction on a state-by-state breakdown of drowning across the United States. This first slide depicts all age ranges across the states. The darker the shade, the more drownings the state experienced. And this is an average between the years 2008 and 2014. You can see some of our southern states experience a higher drowning rate than some of our northern states. And on this next slide, this is specific to children below the ages of 19. Between the 2 slides, you can see that the states of Pennsylvania, Ohio, for example, Nebraska, and Kansas got a little bit darker than when we just focused on adult drownings. So just some general facts regarding drowning. In 2015, drowning accounted for 1/3 of the unintentional injury-related deaths for children 1 to 4. Now that's out of the top 10 incident types, so when only considering the top 10, those victims, 1/3 of them were drowning victims. In 2015, the CDC reported that 636 drowning fatalities were experienced by children birth to 14 years of age. And in 2015, drowning is in the top 3 unintentional injury-related fatalities for ages birth to 35. More than 1 in 5 people who die from drowning are children younger than age 14. Now, when we take across the whole lifespan and older adults, that's a pretty significant number, stating that 20% of drowning victims are children. For every child who dies from a drowning, another 5 are estimated to receive emergency department care for a non-fatal submersion injury. Now, while non-fatal can be a little bit misleading, so I'd like to talk about that for just a moment. Non-fatal drownings are classified as a victim who has survived the initial event of drowning in water. That is not to say that the child or the victim of any age has not experienced some other trauma to their body. For example, a child who is been underwater for 10 to 15 minutes may experience traumatic brain injury from lack of oxygen reaching the brain. So while for every 1 child who dies, another 5 receive emergency department care, I don't want you to walk away from the presentation thinking that these are children who were observed in the emergency department and released, that evening. These children may have long-stemming problems as a result of their drowning incident. Some additional statistics, looking at the range of years from 2005 to 2014 for all age ranges. In total, there's an average of about 3,500 fatal unintentional drownings every year. Now that number does not include boating, drownings related to a boating incident. If we were to include those numbers in, that number elevates by about 300 to 400 on the annual basis. Now again, that's an average, so some years we're below the 3,500 mark, some years we are slightly above that number. That breaks down to an average of about 10 drownings per day experienced in the United States. And again, 20% of those drownings are with children young ages under 14. Now, some statistics that aren't on the slide that I'd like to include here. The American Academy of Pediatrics released a technical report on the prevention of drowning in 2010. As part of that, they looked at a large national study that included 1,420 drowning deaths of individuals less than 20 years of age. 47% of the drownings investigated, 47 were in freshwater. That includes lakes, ponds, and rivers. 32% were in swimming pools, 9% were in the home, and that includes bathtub and bucket drownings, and 4% were in saltwater environments. So location does impact drowning. Out of drownings for infants, 78% of infant drownings are in a bathtub or in a bucket. So an important takeaway message here, bath seats are not a replacement for supervision. Even in a bathtub, parents need to maintain constant supervision of their children. I'd like to transition now to talk about something that's been getting quite a bit of media attention over the past few weeks as we lead up to summer. And that's the topic of near drownings, dry drownings, secondary drownings, or often called delayed drownings. Dr. Hawkins, Dr. Semsbrot, and Dr. Schmidt released a paper just a couple of weeks ago. These are 3 medical doctors who work in drowning prevention and wanted to provide some clarity to the topic of dry drowning or secondary drowning. These cases are extremely rare. Sometimes when things get presented in the media with such a big push as we've seen in the past couple weeks, we can think these incidents happen much more frequently than they actually do. These are victims who have suffered a non-fatal drowning and have developed some type of respiratory distress after the event. These respiratory distress signs typically emerge immediately after the drowning and up to 2 to 3 hours after the drowning. The real interesting thing here is, and where the confusion comes in, dry drowning and secondary drowning are not true terminology. These are victims who were submerged in water, experienced a non-fatal drowning. The cause of this is, as part of that non-fatal drowning, they may have ingested just a little bit of water, a very, very small amount of water, into their lungs. And that water, after the event, can start causing some respiratory symptoms, including difficulty breathing, coughing, potentially a little bit of foam forming around the mouth, and early stages of hypoxia, which is when enough oxygen is not reaching all the blood cells in the body. You also might see a bluish tint or bluish color to the nail beds, nose, lips, or ears, areas of poor circulation around the body. These victims who experience these symptoms after their non-fatal drowning should be taken to an emergency department and should be observed for a period of about 4 to 6 hours. If the symptoms don't persist, they will be released from the emergency department, and if the symptoms do persist, they'll be able to get immediate treatment. Where the confusion comes in is sometimes this is presented in the media that this can happen many hours or days after the non-fatal drowning event, and that is simply not true. These symptoms will begin in the non-fatal drowning victim very quickly after they are out of the water, and they do need to be seen if they're experiencing the symptoms by the emergency department. However, this is not something where a child who experiences a non-fatal drowning will experience these symptoms, a day or 2 days after the initial drowning incident. That simply does not happen. It's important to notice these signs. Lifeguards are trained to notice these signs in a victim that they rescue from the water. A lot of the times that's why we'll ask a victim if once they've been rescued if they swallowed any water to see if there's potential that any water may have entered the lungs. When we talk about higher risk populations among drowning, higher risk has been noted among immigrant populations, minority communities, and individuals with disabilities. And gentlemen on the line, I regret to inform you that 80% of drowning victims are indeed males. And that 80% does hold true when we discuss children drowning as well. When we discuss minority populations, African Americans ages 5 to 19, the CDC reports that they drown in swimming pools at a 5.5 times higher rate than Caucasian children of the same age. When we drill down and look specifically just at the 11 to 12-year-old breakout for African American children, the CDC reports they drown in swimming pools at a 10 times higher rate than Caucasian children. American Indian and Alaska Native children drown at a 3.1 times higher rate than Caucasian children. Why that is and the factors that can influence drowning. In many cases, it's a lack of swimming ability. So swimming lessons are important, making sure a child learns swimming and is introduced to water at an appropriate age and begins building that confidence around the water. There's sometimes lack of barriers around water to prevent access to the water, and in many cases, lack of supervision. As stated earlier, the location can also impact that as well. Adults or children that can't swim should use proper flotation devices such as life jackets approved by the U.S. Coast Guard. And you should also check that flotation device to make sure the weight of the child matches the type of flotation device that they'll be using and it fits properly. Alcohol and drugs can also impact drowning, also from a victim standpoint and also from a supervision standpoint, and also other medical conditions such as epilepsy. So individuals with epilepsy, given there's a chance that they may lose control of their body, if they're in the water, there should be obviously proper supervision and ability for a quick response. Diving in a little bit deeper to individuals with disabilities, I get this question quite a bit. How many children with autism or intellectual disabilities are drowning every year? And that's something, unfortunately, the drowning data from the CDC can't drill down to those numbers. In many cases, that's because the disability is not coded with the actual drowning. So what I am able to report to you to kind of put this in perspective of how often these children with disabilities are drowning or what their risk level is that a standardized mortality ratio has been calculated. Now, a SMR, or standardized mortality ratio, anyone who has a greater number than 1 is more likely to experience a higher death rate for the incident. So if you have no higher risk of drowning than your same-aged peer, your SMR is 1. An SMR for drowning for an individual with mild autism is 3.9, meaning they are 3.9 times more likely to drown than their same-aged peer. And an SMR for drowning with individuals with moderate, severe, or profound intellectual disabilities can go as high as 13.7. That's a 13.7 higher times risk of drowning than their same-aged peer. So I'll end my part of the presentation talking a little bit about some recommendations for parents and community members to stress. The biggest one is learn to swim. Stress learn to swim among families, among your own children. Learning to swim does not make a child drown-proof. Drown-proofing is not a thing. There is no way to even drown-proof an Olympic swimmer. We all have a drowning risk, but learning to swim decreases that risk. Use layers of protection. We often say in drowning prevention, it's not just one layer of protection that's going to make the difference. It's a multitude of layers. And that includes always swimming in a designated swimming area, choosing an area that is safe for swimming, a swimming pool that has lifeguards, a roped-off beach that has been designated and checked for underwater hazards, picking a proper area and making sure it is safe for swimming, using appropriate flotation devices. I know we probably all grew up with water wings and the floaties that can go on children's arms. Those are absolutely not the same as an approved flotation device. An approved flotation device is something that's been tested and approved by the United States Coast Guard for a specific weight class. I do not have a picture of my presentation, but one of the approved flotation devices for children, they're called puddle jumpers, where they have some arm floaties, but there's also a flotation piece that goes across the chest. But one thing to be careful with, even flotation devices like that, I have seen some on the market that are tested and approved by the U.S. Coast Guard, and I've seen ones that look identical that are not tested and approved by the U.S. Coast Guard. An easy way to check is to flip the device over, and somewhere there should be an imprint, and you'll see the words U.S. Coast Guard approved and a specific weight class. Never swim alone. That goes for children and adults. If no one's around to help us and we get in danger, there's no one around to help us. So it's important that we never swim alone. Use a water watcher, which is a designated bystander who is constantly watching the individuals that they're responsible for in the water, or swim near a lifeguard. That's the biggest thing I can stress. Swimming near a lifeguard means you're being watched by individuals who have proper training to respond to individuals who are in trouble in and around water. And even if you are swimming with a lifeguard, stress that parents still watch their children. A couple years ago, I went to a pool that I used to work at a number of years ago, and actually volunteered to work a pool party as a lifeguard. And one of the parents recognized me and came up from years ago when I used to work there and said, you know, Adam, it's great. I still love bringing my kids here because I don't have to watch them. You guys are so good at what you do. And I about fell over because as a lifeguard, I'm responsible for watching everyone in the water. As a parent, if you can just watch your children, you can help us do our job even better and really, truly prevent something horrible from happening. Even though we take layers of protection, we put barriers around the water, we learn to swim, we use a designated area, we use proper flotation, accidents can still happen. So it's important that we're ready to respond. Everyone should know CPR and have proper first aid training. And if you're around water, you need to have quick access to the 911 system, be able to make that 911 call as quickly as possible, and have rescue equipment ready to go. Lifeguards are trained to go into deep water and rescue a victim. Bystanders are not. If you don't have the proper training to go out and rescue a drowning victim, that could become incredibly dangerous for you. That drowning victim can latch onto you and may take you down with them. So it's important that you learn basic water rescue skills, including how to reach something out to a victim and how to throw something out to a victim who's in trouble. And my last key point, which I can't stress enough, supervision is key. Keep an eye on people around the water. Swim in groups of people. Don't swim alone. So that ends my portion of the presentation, and I will turn it over to Mr. Korn.
Thank you, Adam. I'm happy to be with you all this afternoon. I'm particularly excited to see so many names that I recognize on the attendee list. Carol from Georgia, Dwayne from South Carolina. Wake up, Dwayne. I see Alyssa also from Texas. So let's make sure we all connect and reconnect after this with additional questions and ways to work towards preventing drowning and water safety issues. This portion of the presentation is really divided into two parts. One is the government's role in preventing drowning. And to say that the federal government has jumped into the pool would be an understatement. They have been very active in drowning prevention and water safety issues over the past 10 years. We'll also talk a bit about state governments and how they get involved. And in my opinion, they are the first line of defense. What cannot be done by the federal government can be done by the state government. And that's where all of you come in, if you're willing and if you're able, and we can help you get to both those characteristics, to work with your state legislatures, your county councils, your municipalities to move governments to take proven steps to prevent injury. The second half of the presentation will go into a little bit of detail about what I think and what Abby's Hope and other drowning prevention organizations believe are the most important things we can all do together, sometimes with government's help, sometimes on our own, to prevent injuries from happening in the first place. So we'll get started. This year is the 10th anniversary of the Virginia Graham-Baker Pool and Spa Safety Act. We're going to talk a little bit more detail in a couple of slides on that piece of legislation. But the namesake of that piece of legislation, which, by the way, is the first time the federal government, the United States Congress, ever addressed pool and drowning prevention in any fashion, and it passed 10 years ago. This is Graham Baker, the granddaughter of Secretary of State James Baker and daughter of Nancy Baker. I work for their family also, along with the Abigail Taylor family, which I'll introduce to you in a sec. This is Graham, who died in a residential pool when she became entrapped at the bottom of a spa. Now, it wasn't a hot tub. A hot tub in the industry is what is brought on a truck to your home or to a hotel and sits on top of a deck you see in a showroom. A spa is actually attached to the pump system of the pool. Usually it's just next to the pool at the same level of the pool, often a spillway into the pool. That's a spa. Well, this child, who was a very good swimmer, was on her local swim team here in Alexandria, Virginia. I happen to be in Washington, D.C. Alexandria is just a few miles away from me. She was a very good swimmer on her swim team. She jumped in the pool and within seconds was sucked to the bottom of the pool. She basically drowned at the bottom of the pool, notwithstanding the fact that people were alerted to there was trouble at the bottom of the spa. The mother jumped in. Nancy Baker could not tear her away from the drain. Two large males, adults, jumped in, and it took them several minutes to literally rip her off the bottom of the pool. She was sucked to the bottom of the pool with pressure that no human being can themselves break to free themselves. This child died from a drowning. Nancy believes that she was dead when they brought her out of the pool. She was declared dead at the hospital later. Sorry to be a bit morbid, but these are the faces behind the piece of legislation that passed 10 years ago and for which we are celebrating the anniversary of this year. These are two other children who died during the course of the negotiations for the Virginia Graham-Baker Pool and Spa Safety Act. A coincidence, yes. A perfect storm, also. On the left is Abigail Taylor, who sat down on a drain in a wading pool and was eviscerated. A little bit different than entrapment, but it is considered an entrapment. I'm sorry to be a little bit descriptive on this. I'll soften it just a bit because it is disturbing. She sat down on the drain. She was eviscerated from the suction, meaning her insides were pulled through and out of her rectum, and she died. There was no way to survive that after an heroic battle. The young boy to the right is Zachary Cohen from Greenwich, Connecticut. By the way, Abigail Taylor died in a public pool. Graham, from the first slide, was a private pool, residential pool. And Zachary Cohen died in a residential pool. His arm got stuck in the vacuum or drain system of the pool, was sucked in. His parents could not free him, and he drowned because he could not free himself to get a breath of air. Very tragic, and these families work to this day quite vigorously. We'll talk a bit about that in a sec, to prevent entrapment from happening in the first place. That's what it looks like. Again, I apologize. This is a child that actually survived an entrapment. Happened just before the Virginia Graham-Baker Pool and Spa Safety Act was passed. Just before it started, we started our negotiations and lobbying effort, for lack of a better way of saying it, on Capitol Hill. These two different children, survived. You can actually see the imprint of the drain on both these injuries, in particular the one in the middle. I think we have a pointer here, right here. You can see the imprint of the drain. I actually carry that drain with me as I do presentations around the country or do media on television to kind of show. You could actually see that drain as the child was peeled off that drain. Both these children were survived with no adverse effect, thankfully. They were peeled off the drain, not pulled off the drain. These are examples of dangerous drain covers. Dangerous drain covers are flat or flush to the bottom of the pool. You can see a couple examples, or three examples right here. Basically, they're even with the bottom of the pool. Safe drain covers, on the other hand, are convex in some fashion. Convex. They're domed. I like to say, if you can stub your toe on the drain, it is a safe drain cover. These you still find in the marketplace, but not nearly as much as we used to. I'll talk about that in a sec as we talk about the requirements or the obligations on pool and spa owners because of the Virginia Graham-Baker Pool and Spa Safety Act. This is a safety vacuum release system. It's another backup protection that is attached to the pump of the pool, and when it detects any kind of suction, whether it's caused by a body or a towel or a plastic bag, it shuts the pump off automatically. These are required in special circumstances under the law. I won't go into too much detail about that, but we'll talk about it briefly because it's an important backup safety device. Okay, the background to the Virginia Graham-Baker Pool and Spa Safety Act. I'm going to spend 2 seconds on this because it's the politics behind it. It was basically Congresswoman Debbie Wasserman Schultz from Florida and Amy Klobuchar from Minnesota, although many members of Congress participated in this piece of legislation. Quite frankly, and I would be remiss if I didn't mention that when I said the perfect storm, when someone like the Secretary of State James Baker loses a granddaughter to a pool or spa injury, and he was willing, along with his daughter-in-law, you see her second from the right here, to move and advocate on behalf of children. It was very tough for people to say no. He is, I guess by reputation and what I know of history, the gold standard of government service, and former Secretary of State, Secretary of Treasury, and Chief of Staff for Reagan. So that was actually a very moving afternoon with the President when he signed the bill. But I'll move on, not germane to this discussion. The requirements of the Virginia Graham Baker Pool and Spa Safety Act are about 6 or 7-fold, and I'm going to give you the cliff notes on that. And I say cliff notes because if you were to read the legislation, and you can find it online, I can help you get there if you like, it wouldn't make a damn bit of sense to you. To me, it was like reading Shakespeare when I was in high school. I didn't understand a damn word he said until I read the cliff notes. And then I went back to the original text, or at least I told my parents and my teachers that I went back to the original text, and it kind of came to life, and you could appreciate the genius that was Shakespeare. Well, if you were to read the act itself, it wouldn't make any sense to you. This is your cliff notes. If you pay attention, and I'm hoping you are, to these little 7 components, if you go back to the bill, it'll come to the law, it'll come to life for you, and you can read it, and it really is a beautiful piece of legislation. The reason I say beautiful, and I'll pause here for a second to say that since the passage of the Virginia Graham Baker Pool and Spa Safety Act, there has not been a single entrapment in a public pool in the United States. They just celebrate the 10th anniversary with a hearing on Capitol Hill just about 2 weeks ago, which you can watch on tape or stream through the congressional website. And if that's not a comment on its success, I don't know what is. All right, here are the 7 requirements. First of all drains, by the way, let me take one step back. It addresses both entrapment and traditional forms of drowning, and we will talk about both in this presentation. First of all, all drains that are sold in the United States have to now meet a drain safety standard, like a UL standard. It is not a UL standard, but it is at an accreditation with the supervision of the Consumer Product Safety Commission, the agency in charge of implementing the Virginia Graham Baker Pool and Spa Safety Act, to make sure that all drain covers meet a safety standard. I'm not going to go into detail because I don't understand it, and cliff notes don't even help me as to the hyper-technicality of a drain and what it needs to do. Flow rates, tension, the quality of the plastic, the quality of the screws, all those things go into the safety standard. You must sell a compliant safety standard in this country. Number 2, and this I think is the most important component, believe it or not, is it makes it illegal to sell non-compliant drain covers in the marketplace. Okay? Now I'm going to tell you why I think that's the most important component in a second. In other words, it is illegal to sell the dangerous flat drain cover. You must sell a compliant drain cover. And I'm going to come back to that component in a second. Third is it requires the use of those compliant safe drain covers in all public pools, not residential pools, but public pools. And the Act defines public pools as basically any pool that is not in your backyard is a public pool. Hotels, motels, summer camps, YMCAs, private country clubs, community centers, boys and girls clubs. If it's a public pool, you have to have the safe drain cover in it. Does not apply to residential pools. Let me go back to the second component for a second. It is illegal to sell non-compliant drain covers. Congress, and I remember these discussions very well, did not feel it had the ability to reach into the backyards of people to require the use of these drain covers. That's why child safety seat laws, smoke alarm laws, bike helmet laws, carbon monoxide detector laws are all passed by state legislatures or municipalities, not the federal government. They could not reach into your backyard, but they did make it illegal to sell the drain covers. So, over time, as pools are built, whether or not public or residential, you cannot but find the safe drain covers in the marketplace. So, as you maintain your pools, as you change out the drain covers, you're going to automatically put in a safe drain cover because you cannot find the dangerous ones in the marketplace. I think that was the genius of this bill. That was actually Debbie Wasserman Schultz who added that particular component. There are some special circumstances for single main drains. I'm running out of time, so I'll just say the safety device that I showed you before, the safety vacuum release system, if there's a single main drain, in the bottom of the pool, you have to have that backup piece of safety device. All new pools moving forward can no longer be single main drain pools. You have to have at least 2 drains at the bottom of the pool. And that is because if you cover one, you still have flow down the other. I always use the visual of a vacuum cleaner with a little, to get the cobwebs out of the corner. If you put your hand on top of it, it sucks the hand to the tube. If the tube had 2 openings, you cover one, there is still flow. The laws of physics are the same when it comes to a pool. I'll skip down. It establishes a grant program to kind of motivate states to pass legislation to require these safety devices in not just residential public pools, but in residential pools with some success, not great success. And it also established the Pool Safely campaign, which is the Consumer Product Safety Commission's education campaign. I commend all of you to, after this presentation or sometime in the next couple of days, to log on to poolsafely.gov, sign up as a partner, and start basking in all the resources that are out there that the federal government supplies to you for free as it relates to both entrapment and traditional forms of drowning. Many of the things that Adam talked about in his earlier. All of it is free, and you get notices in the mail. I just can't emphasize that enough. Poolsafely.gov. It's excellent, an excellent resource. I'm not going to talk too much because Adam talked about this. We in the drowning prevention, and I know many of you know this, the names I see on the attendees list have been doing this even longer than I have. But four-sided isolation fencing is the gold standard, the Cadillac standard of injury prevention. And four-sided fencing is when a fencing goes all the way around a pool. There is no access from the house. You have self-locking, self-latching gates. That means a gate that closes by itself and locks. There are requirements for how high the fence can be, no vertical slats that a kid can climb. Some state legislation requires fencing. Some of it does not require isolation fencing, meaning 4 sides around a pool. Some allow 3 sides and door and window alarms that have access to the pool. Not the perfect solution, but my political or my advocacy philosophy has always been, at least in this case, don't let the pursuit of perfect be the enemy of good. You can get 3 sides around a pool and hit door alarms and window alarms to prevent or at least warn of access. I love electronic or manual pool covers as long as they're used after a pool time is finished. Adam talked about learn how to swim. I won't add to that except as to say my favorite line, learning how to swim is not just a life skill, it's a life-saving skill. It's much different than tennis and football and hockey and all the things our kids do. Those are life skills, wonderful lessons involved in it, and we want our kids out there enjoying those things, but learning how to swim is actually a life-saving skill, not just a life skill. Bystander CPR, it's always good if you're not certified fully for CPR, it's always good to at least get bystander CPR. And we talked about active supervision. Adam emphasized that. I agree 1,000% with him, so much so that in a bit, if I have time, I'm going to talk about that one in a little bit more in depth. Some resources for you. We've got some, these are some drain boards that Abby's Hope uses. They've got posters and visuals that show what a dangerous drain cover looks like. The one on the left is the dangerous drain cover, flat, and here is the domed-shaped one. Can't really tell. This is a static version of a 3D model. Boy, we have a lot of them to give away for free. Not enough to supply everybody, but maybe if you're particularly interested and do a lot of drowning prevention education, you can convince us to send you and mail you a set of these two drain boards. Great visual. People don't understand it until they see it and touch it. This is I'm going to really fly here, something that we did with the Zach Foundation. You can find it on the Abby's Hope website, also on the Zach Foundation website that explains entrapment in a very easy style that can be used in your sessions. If you were confused by what I had to say, I'm hoping that's not the case. This will even clear it up even more. Maybe call it the Cliff Notes to even the Cliff Notes. Very well done. This is the Water Watchdog tag. Adam talked about this. I'm getting close to running out of time, but I want to emphasize this. There's so much we can do to prevent drowning, the layers of protection, the barriers, so important, the drain covers, all the physical things that we can do to a pool. In my opinion, there is no substitute for active supervision. And Adam was 1,000% right to say that drowning does not happen the way it does in the movies. Help, help, I'm drowning. Lassie runs and gets someone, and they come back and you can save the kid. A child goes under, and you can see many, many videos of that, very disturbing. A child goes under, and that's the last you hear of them. So use the Water Watchdog tag. That's the one of Abby's Hope, but all the groups out there have them, including the Pool Safely campaign. You wear it for 15 minutes. You're not on the phone. You're not socializing. You're not reading a book. You're not drinking. You're not eating a hot dog. You are watching the children. Then when your 15 minutes are up, I hand it over to Adam, and he watches. There's something special about the physical nature of having something hang around your neck. That lanyard changes the way you perceive your responsibility. Okay, I'm very close to out of time. I'll fly through these. This is a PSA. I'm wondering if there's a link here. Let me see. I don't know if it'll work. There's a PSA that we think is wonderful at Abby's Hope. Please use it, and abbyshope.org. It's a 30-second PSA. I think it is fantastic. I really do. I'm sorry. Maybe I'm a little biased. Please use it. Spread it around. I was hoping we could spend 30 seconds showing it, but I'm not sure there's a link here. So you'll have to take a look at it yourself. It's right on the home page. Please steal it. Use it. It's quite moving, if not a little disturbing. We have some posters. I'm going to skip through it. And finally, with the last 30 seconds, I want to talk about Families United to Prevent Drowning. There are some members of that group on the call right now. This is an informal group. I see someone posted the YouTube video in the chat presentation, so have a look at it when we're done. Thank you, Rebecca. Families United is an informal group of families who have had a loss due to entrapment or drowning or a near drowning. It started about 6 years ago, excuse me, with about 5 or 6 families. It is now up to 35 or 36 families. It is really, to its credit, taken on a life of its own. Excuse me while I wet my throat a little bit. It started out as very much a support group for these families, technical assistance as these families started to work in their communities to prevent drowning. And it still serves that role. But it has also become an organization in and of itself that people turn to get the story behind the statistic, the face behind the statistic, the family behind the statistic. And it's quite moving and quite effective. All of the members of Families United are ready, willing, and able to help you in your communities. Many of them are located where you are. There are 35 of them that are members so far. There's 2 pending right now. Take a look at the website, familiesunitedtopreventdrowning.org, and you can click on to the individual. I suggest you spend a little time with each of the family story. Have a box of tissue by the side, but find out which one's close and start engaging these families, because it really does change the messaging. It makes it with much, much greater import. Much more to say there for Families United, but I want to, like Adam, respect your time and keep to our 20 or 25 minutes apiece. Thank you so much for your attention, and like I said, for those that know me and remember me, even those that don't, let's make sure we connect after the call. I mean, really, the list goes on and on here about people, the names I recognize on the attendee list, and it's wonderful to see those names. So thanks so much, everybody.
Great. Thank you so much, both Adam and Alan. Fabulous presentations, a wealth of information that I know all of our participants can use. We have some great questions, so I want to go right to those. And the first question I think we'll address to Adam. Adam, the question is, or the statement is, I recently read that swimming lessons among toddlers and young children can make them more attracted to water and make parents and caregivers overly confident in their ability. Can you talk about addressing increased risk among toddlers and young children enrolled in swim lessons? And I think you said swim lessons when appropriate, but how does somebody know when it's the right time?
Sure. So I'm going to address this on a number of different fronts, and I know exactly the article you're referring to that was published just a few days ago with a little bit of a misleading title to the publication. So the background of the publication, I believe what the author was trying to get across is there has been research done to show that after parents enroll their child in swim lessons, the parents sometimes are overestimating, and in some cases so is the child overestimating the child's ability in the water. So a parent is actually thinking the child is safer around the water than what they actually are as a result of the swim lessons. And well, yes, absolutely 100% we encourage swim lessons for children. The American Academy of Pediatrics recommends that children start swim lessons. I believe it's now at the age of 4. It used to be 5. I believe they've recently dropped it to 4 years old. A number of the agencies that provide instructors for swim lessons, the American Red Cross, Starfish Aquatics Institute, YMCA, some of them have lessons that begin as early as 6 months of age, and for those children it's water exploration, learning some basic aquatic skills and floating, and motor development-wise the child is truly ready to learn to swim around age 4, age 5. So the idea here in breaking down this article is swim lessons are important. What parents still need to do, though, swim lessons are not a replacement for constant vigilance or constant supervision around the water. I've also spoken to others about this same article in the past 24 hours, and one of the things that I've brought up to them is the fact that even though a child's enrolled in swim lessons, it's absolutely great. Water safety information should still be shared with the parents and the child during swim lessons. So the child's not only walking away with the ability to learn to swim, but they're also learning some cognitive information and motor skills on how to help themselves or help someone else if they're in trouble around the water. And also the instructor of the program hopefully will be reminding mom, dad, grandma, grandpa, who's ever bringing that child to swim lessons of some important water safety information. So at the heart of it, you know, the research backs up what the article's saying, but I think it was presented in an incorrect way.
Great. Thank you, Adam. I just want to point out to our viewers that at the left side of your screen, there are links to both the Pool Safely campaign as well as the PSA that Alan mentioned. Alan, another question, a question for you. Can you address, does the Virginia Graham-Baker Act include rental properties that have a pool?
I saw that question from Laura, and Laura, if you're out there, that is an excellent question and just came up 2 weeks ago in the Senate hearing as to whether or not an Airbnb type of property would be now considered a public pool and therefore be required to comply with the Virginia Graham-Baker Pool and Spa Safety Act. My answer to that question to members of Congress, and in particular their staff, was yes. It's no different than a motel pool. Most of the staff agreed, but felt that the piece of legislation was quiet or confusing as it relates to that particular venue. Airbnb did not exist 10 years ago. So the bill is going to be, we hope, amended over the course of the next few months on a couple of different ways, I believe improved, and that question will absolutely be addressed in the new round of the regulations that support the VGB. In the meantime, I think even without those changes, by the exact definition of the pool, of public pool in the piece of legislation, I don't even think we need that clarification. But in order to be clarified, they're going to change that. So the answer to your question is I believe yes, but very soon it's going to be expressly required. So an excellent question.
Great, yes. Thank you. And I'm terribly sorry that we are already out of time. The information you've both provided has been so helpful, and I want to thank the audience for your time. I hope you all have an injury-free summer, and just to round things out, we would like to ask you to take a moment to complete the evaluation of the webinar. So thank you all very much. Greatly appreciated.